Hello everybody, welcome back. Hope everyone had a great weekend. It's Greenhouse Wellness, Sierra and Dr. Apgar with another Medical Mondays with Dr. Apgar. Today we are talking all about a really hot topic actually, which is cannabis myths, and we're going to debunk some for you. So if you're tuning in live with us today, thank you. Let us know where you're coming from or watching from, and let us know if you have any questions or myths that you'd like us to answer while you're here. So we're going to start out with the myth that all medical cannabis will make you high.
So actually that's not true, and here at Greenhouse Wellness we're working very hard to incorporate lots of products that have different CBD ratios. So obviously medical cannabis has a lot of different compounds within it. In fact, there's close to 400. You have probably heard of CBD or cannabidiol and THC, which is the compound that gives you that cerebral high. But most of our patients are not looking for that high at all. And if you increase the ratios of the CBD to the THC, they get all the wonderful benefits of the cannabis, but without that cerebral effect that they don't want. So we're working really hard to increase our options for our patients. We're very excited. We've gotten some high CBD products in lately, and we have more coming.
Awesome. So another common myth that I always hear is that you have to actually smoke to get the effects of cannabis.
And smoking is bad. We know that we don't want to smoke. We would rather our patients vape it. And there's a lot of medical reasons for that. A lot of the compounds that are in cannabis, the terpenes and the different cannabinoids, are burned off or combusted when cannabis is smoked. And we really want our patients to have the full medical effect of these wonderful compounds. And that's why we always encourage our patients to vape the medicine starting at a very low temperature. But cannabis can be consumed in many different ways. Smoking and vaping is just one way. It can actually be taken as a tincture under the tongue. It can be even microdosed by putting a few drops in a liquid. It can be put in an elixir, and it can be consumed by drinking it. And a lot of our patients do that at bedtime. It gives them 6 or 8 or even longer hours of sleep. And it can also be placed topically in a gel or cream or a patch. And that gives localized pain relief right at the site. All these different ways of taking cannabis affect the body a little bit differently, and that's why we spend a lot of time with our patients here and educate them so that they get the best modality for their particular problem.
Love that. So if you're ever confused, we take a lot of pride in the fact that we educate our patients on all the different delivery forms. So come see us if you're ever confused or if you're a newbie. That's what we love. So number 3 myth that we want to ask about is that the effects are the same regardless of your delivery system.
And that's totally false as well. Now, if somebody's in terrible pain and they want immediate relief, then that's when I would recommend that they vape the product, because that's going to give them the fastest relief. But if a product is consumed, if a cannabis product is consumed, meaning that it's put in a drink and consumed that way, the effects take a lot longer to work. But the way that our body works, that medicine is delivered to the liver, and the liver converts the delta 9 THC into delta 11 DHC, which is actually 10 times stronger than delta 9 THC, and it affects the body a little bit differently. So it's a different feeling than when the cannabis is smoked or baked. That feeling will last a long time, so that the patients will get a lot of pain relief if they ingest it. And then if medicine is applied topically, it's really not psychoactive at all. It just stays localized in the tissues. So they definitely have different effects.
It's really interesting. Number 4, and this is my personal favorite myth because I think a lot of us were taught to believe this growing up. And we're going to talk now about why it's a myth that using medical cannabis leads to more drug use and is considered to be a gateway drug.
Oh my gosh, nothing could be further from the truth, actually. And there's some studies out on that that show that there's absolutely no link to illicit drug use or to other dangerous substances. At Greenhouse, we like to think that cannabis is actually an exit drug. because we've seen it firsthand in person that patients who have been chronically addicted to opioids are now completely off of their opioids, some of them completely off of their opioids. That is astounding. And we have a number of patients that have drastically reduced the number of opioids that they are on. So I can't tell you, probably the most common concern that I get is patients coming in saying, I don't want to be on these narcotics, I don't want to be on these benzodiazepines, I want off of these potentially addicting medications, and cannabis is wonderful to help the patients do just that.
Awesome. Yes, Kate, we consider cannabis to be an exit drug.
It's an exit drug.
Yes. Number 5, cannabis kills brain cells.
No, it doesn't. No, it doesn't. And in fact, there's actually a study from the University of Louisville that contradicts that entirely. There's no evidence that it does. Cannabis has multiple anti-inflammatory and antioxidant properties and is considered neuroprotective and neuroregenerative. So there are some amazing studies looking at Alzheimer's I've been looking at right now, where the use of cannabis actually halts the mental decline of Alzheimer's in its tracks. So it's pretty cool that we're finally getting some good research into the neuroregenerative properties of cannabis, but no, it does not kill brain cells.
Awesome. Last, number 6 myth is smoking cannabis is worse for your lungs than tobacco.
Nope, untrue. In fact, the properties within cannabis are oftentimes anti-neoplastic, or they protect you from cancer. And it turns out that if you smoke cannabis and if you smoke tobacco, the tobacco users have a higher incidence of lung cancer. So there are properties within cannabis that are somehow protective. However, I want to say again, we always recommend that our patients vape the product instead of smoke it.
Awesome. Thank you so much, everybody who tuned in today. We really appreciate it. Keep dropping your comments and questions below. We will continue to answer. Thanks to Dr. Apgar, and we will see you guys soon. Happy Monday.